Why is ethical vaccine distribution challenging in bioethics? Have you ever wondered why distributing vaccines ethically is such a tough challenge? It involves balancing several important medical ethics principles that shape healthcare today. These principles include fairness, equity, respect for individual choices, utility, and social justice. During a pandemic, these principles can often conflict, making decisions about vaccine distribution quite complex. First, let's consider fairness. This principle demands that vaccines be shared equitably among different groups. The focus is on prioritizing those at the highest risk, like frontline healthcare workers and vulnerable populations. However, achieving fairness is not easy. Wealthier countries often secure large vaccine supplies early, a situation known as vaccine nationalism. This practice leaves poorer countries with limited or delayed access to vaccines, which goes against the ethical ideal of equal access to healthcare resources worldwide. Next, we have respect for individual choices. This principle means allowing people to make informed decisions about vaccination, including which vaccine they prefer when multiple options are available. Unfortunately, when vaccine supplies are limited, this can restrict choices, creating a challenge for this principle. The principle of utility is also significant. It focuses on maximizing the overall benefits of vaccination programs. This means using limited resources efficiently to reduce illness and death. However, this often requires prioritizing certain groups, which can conflict with the idea of equal access if some populations are deprioritized. Social justice plays a key role as well. This principle emphasizes addressing systemic health and social inequalities that affect vaccine access. Vulnerable groups, such as low-income individuals and marginalized communities, may face barriers like high costs or lack of healthcare infrastructure. These barriers complicate fair distribution of vaccines. Moreover, there are additional challenges due to the lack of enforceable international frameworks for equitable vaccine sharing. Coordinating global governance can also be difficult. Organizations like the World Health Organization have initiatives to promote fair access, but these efforts often struggle against national self-interest and logistical challenges. In practical terms, ethical vaccine distribution requires transparent and rational prioritization processes. These processes should consider biomedical risk factors, social vulnerability, and geographic disparities. Governments have a responsibility to support vulnerable populations to ensure they have access to vaccines, regardless of their ability to pay. It is also ethically justified to prioritize healthcare workers to maintain the healthcare system during a crisis. Navigating the competing ethical principles of fairness, autonomy, utility, and social justice within a context of global inequality and limited resources makes ethical vaccine distribution a challenging task. Addressing these issues requires coordinated international cooperation and clear ethical frameworks that prioritize vulnerable populations while maximizing public health benefits.